Mic check, mic check. Should go in here. Testing, 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 testing. Hello. Hello. I'll just start over for the purposes of Altar Live. Well, welcome everybody. We're lucky to have Jacqueline LaFerriere and Sarah Sheehan, who are going to introduce us to the topic of the, well, as the screen says, racial disparities in maternal health care. And they brought us that topic because they have been volunteering with an organization in Boston, the Neighborhood Birth Center, which is creating a freestanding birth center separate from hospitals, but with access to hospitals, that is expected, I think now it's 2025, I think, when it should be opened. And so they're going to talk about the sort of background and issues over many years. And then on Wednesday night, one of our speakers is Miriam McPherson, who is the co-chair of the Neighborhood Birth Center. And we've also been lucky enough to get a second speaker from a group called Vital Village Networks. And what they do is more of the community work to connect people who don't have pregnant women, and women about to give birth with healthcare options, community services, support, and things for their children once born, early childhood education, intervention kinds of things. So it's a whole network of community programs that supports mothers in Boston. It's another very interesting organization, and they're going to speak Wednesday night. So we hope everybody can come to the supper starting at 5:30, and if not, to the lecture at 6:30. So now I will turn it over to Jacqueline.
Thank you, Mary Helen. We're very glad to be able to talk about this today, and you gave us the chance to do this. Today we're going to be talking about racism in maternal health care and the racial disparities that exist. And we're kind of going to give an overarching history of how, as a country, we got to where we are today, what this growing crisis means, and then talk more specifically about Massachusetts and Boston.
Yeah, so just to introduce ourselves really quickly, I'm Sarah, and I've been a member here at this parish for a couple of years. I am a DONA certified doula. I was a labor and delivery nurse, and I'm starting a master's program in midwifery at Frontier University in January.
And I'm Jacqueline. I grew up in this church community. I'm a certified full spectrum doula as well through a different organization. And this past year I've been working at a nonprofit. I was working at a nonprofit in Ithaca that provides free doula care for Black and Indigenous people called the Doula Access Initiative. And currently I'm working part-time as a Montessori preschool teacher and part-time doing the whole doula thing. So some community agreements for this space, and after I read these out, we can add any that you may see fit. But these are just some general ones to keep in mind. So be willing to acknowledge and explore your unconscious biases. You might learn things, hopefully you learn new things here today, and they might challenge some biases you hold, but be willing to be open to that. What's shared here stays here, but what's learned here leaves here. So obviously I think everyone already knows this, but if someone shares a personal story, be mindful of their privacy and don't repeat that story. But the lesson you learn from the story should and can be repeated. Be mindful that your truth can be different from other people's truths. Practicing active listening, so listening to hear when we're in the discussion section and not just to respond. Be willing to be responsible for your own learning. And then language matters. So today, especially around this topic, a lot of people, we say women, but the will probably say women a lot, and it's not a bad thing to refer to women because, in often groups, like, everyone in that group is identifying as a woman, so it's not necessarily a bad thing to do that, but just to be mindful of your language is important.
So continuing in the vein of language, we're just going to go over some definitions because a lot of people come up to me and say, what's the difference between a doula and a midwife? So a doula is a support person who doesn't provide medical care, but provides emotional and physical support before, during, and after birth. So this is someone who goes with the person to the hospital. They can, do massages or aromatherapy. If the, patient is kind of out of it and doesn't feel like they can speak up for themselves, the doula can go to the doctor and say, hey, this patient doesn't want an internal exam right now. What are the alternatives? Can we put it off a couple hours? Or just say, no, she doesn't want it. So a doula really focuses on comfort and advocacy. A labor and delivery nurse is a person who's completed an associate's or bachelor's degree in nursing and supports a person giving birth, mostly medically. A nurse midwife, which is what I'm going to become, is a nurse who has completed a master's or doctoral program in midwifery, who provides medical care for people with uncomplicated pregnancies, so low-risk pregnancies, delivers babies, and provides reproductive and gynecological care for people of all ages, and usually practice in hospitals, birth centers, or even at home. An obstetrician gynecologist is a person who's completed 4 years of medical school, 4 years of residency, and provides reproductive and gynecological care across the lifespan, and they do care for complicated and high-risk pregnancies, and they also perform, obviously, surgical interventions, such as C-sections, and they're commonly referred to as an OB.
Does anyone have any questions so far on any of these definitions? So what we're going to be mostly talking about today is this growing crisis for Black people that are giving birth and the alarming rates at which they're either getting sick in different diseases or dying due to childbirth. So Black women are 3 to 4 times more likely to experience a pregnancy or birth-related death than white women in the US. And this is regardless of their economic status, regardless of what level of education they've achieved, regardless of their health insurance status, regardless of whether or not they have a high risk or a low risk pregnancy. So it's just across the board racially. Then from 2018 to 2020, 35.8% of Black infants in the US were born by C-section compared to 30.9% of white infants. And just across the board, the C-section rate is growing rapidly in the US, which is kind of its whole thing in itself that we could discuss, but it's growing at a higher rate for Black mothers. Black infants have 2.4 times the mortality rate as white infants, so it's not just affecting the people giving birth, it's also affecting the babies. And Black infants are almost 4 times as likely to die from complications. Black infants are almost 4 times as likely to die from complications related to low birth weight as compared to white infants. Low birth weight is one of the things that right when an infant is born, they're checked on what is called an APGAR score, which I don't know.
Oh boy, we'll just keep trying. So, one of the things we're questioning today is just how did we get here? So if we go back a couple hundred years, so Dr. James Marion Sims, he's often called the father of modern gynecology, and he earned this title in the 1840s by perfecting a surgical technique to close vesicovaginal fistulas, which is an opening between the vagina and the bladder that can happen during birth. But he perfected this technique by practicing on 3 of his slaves, Anarcha, Betsy, and Lucy, an extremely painful procedure without anesthesia. Practiced this multiple times. As you can see in the picture down there, there's a statue of Dr. Sims in New York City, and 5 years ago there was growing pressure to take this statue down, and in 2018 they did take it down.
Yeah, and just for context, like for generations he's been revered as the father of gynecology, and only in the last like decade or so, I feel like there's been this outcry. Oh, so more about the historical kind of some history for you of this, how we got to be where we are today. Granny midwives were what people referred to as the black women who had mostly been enslaved, right when slavery was like officially ended, that were mostly the people delivering their community's babies, and it was pretty much exclusively in homes, in people's homes. But as early as the 1800s, laws were put in place from local governments, especially in the South. We're mostly talking about in the South. Like this is where granny midwives were. That banned these lay midwives from practicing, and even though it was that most people were giving birth in home, like almost 90% of people at that time in the South were giving birth in their homes, that number slowly started to go down as this propaganda against the black midwives was being pushed and pushed, saying, you know, they were dirty, they had these harmful practices for the babies, and it was really just like outright racism, citing their blackness as the reason. And this was kind of the first time we saw this attack on midwives, and a build towards building up the hospital infrastructure and the shift towards women midwives, marrying midwives, kind of having ownership over birth to now like white males being kind of what dominates the OBGYN field. So that's the first sign of this. And I just thought this quotation was really important to include when I was doing my research on this. So it says, "One of the darkest moments in U.S. history was the systematic eradication of the African American midwife from her community, resulting in a legacy of birth injustices." Shafia Monroe said this, who's a black elder midwife. That's how she refers to herself. She lives in Portland, Oregon, and she's been practicing midwifery for like 40 years. She's really amazing if you want to Google her. But so we can see today that this eradication of the black lay midwife has direct results now on so many practices that were lost, and a lot of those women brought those practices over from the countries they were brought from, mostly in Africa, when they were enslaved. And they kept that knowledge with them and kept passing it down, but then that stop to it is part of the equation for why we are where we are today. And a lot of black doulas and midwives today are actually trying to like dig up those old practices they used, figure out how to get back to that.
So as Jackie was saying, Jacqueline, sorry, sorry, sometimes I say Jackie. Obstetrics gradually became a white and male-dominated field when before most women were giving birth at home with women attending them, midwives. So even outside of the South, in America in the 1700s and 1800s, birth still occurred at home. As I said, usually attended by a midwife. And in the early 20th century, obstetrics became accepted as an actual branch of medicine. Before that, obstetrics actually was not looked at as a branch of medicine because, as I said, women were giving birth at home, delivered by female midwives. So in the early 1900s, half of women were giving birth in hospitals by that point. They were encouraged to kind of on the basis of this is more hygienic or you can get pain relief in the hospital. And so by then they were attended by mostly male white physicians because at that time, very, very difficult for women or people of color to attend medical school. So these practices were very male, white, physician-oriented throughout the last century. You know, women were put on their backs suddenly to labor, feet up in stirrups. This is very much for the advantage of the doctor. You know, better kind of, they can sit and better angle, and you know, they're not a woman standing up. The practitioner is kind of upside down sometimes, catching the baby. And just easier for someone to sit, not easier for the woman though. In the 1940s, a new practice began where women were receiving chloroform gas during birth. Basically, they were knocked out, often restrained. They forgot the pain. They were experiencing pain, but they forgot about it, which again made birth, you know, under the control of the doctor and the hospital, and kind of cemented birth as like a medical event. So from the 1970s to today, cesarean section rates jumped from just 5% to 32%. And as Jacqueline was saying, that number has been growing. Also, the US ranks poorly in terms of death rate. We are 48th in the world in maternal deaths, and we're 55th in the world in infant mortality. We were going to go more into the chloroform twilight births, but we figured we would go to this slide. So giving birth in prison. So bringing it up to modern times, in 2021, the imprisonment rate for Black women was 1.6 times the rate of imprisonment for white women. Latinx women are imprisoned at 1.3 times the rate of white women. So disproportionately in prison, it's, you know, more women of color than white women. And the majority of women in prison are in prison for nonviolent crimes, usually related to drug possession. That is also a whole topic in itself, very steeped in racism. 6 to 10% of women are pregnant when they're first imprisoned. 2,000 babies are born in prison per year. This picture on the right is a woman in Denver giving birth alone in a cell. Unfortunately, there are many, many stories out there of women crying out for help in prison and no one listening to them, or saying, like, I think I'm in labor, and ending up giving birth alone, or on a dirty floor with a prison guard helping them. Because prisoners have a constitutional right to health care, for many of these women, this is the only time that medical care is available to them. However, this does not guarantee proper care, particularly in gender-related health. 11 states currently permit shackling women in labor. Massachusetts banned this practice only in 2014. I feel like I don't need to really explain why this is a terrible thing. People should be able to move about freely in labor. People often experience like swelling from fluid, so people have told stories of like having bruises on their wrists because of the swelling. Their pain is increased when they're not able to move freely. And again, many women are in prison for nonviolent crimes, so why restrain them? Women usually have 24 hours with their baby and then they're separated, with the infant often being placed in foster care. And only 9 states have nursery programs for prison, permitting the mother to stay with her baby, and Massachusetts is not one of them. So, perception of pain in Black patients. So several years ago, researchers at the University of Virginia surveyed 222 white medical students and found that almost 60% of them thought Black skin was thicker than white skin, and 12% thought their nerve endings were less sensitive than those of white people. So you can see how this racism is still pervasive in medicine today and influences the way that providers provide care. Because if you're thinking, there's a lot of like, oh, Black people have a higher pain tolerance, or if a woman is saying, oh, I have, stomach pains, oh, she's exaggerating. If you Google, for example, what are the causes of high blood pressure, you will see one of the causes is being Black. That was literally taught to me in my nursing textbooks only last year. but race does not cause disease. Racism can definitely contribute to disease. You know, if people are experiencing discrimination on a daily basis, that would absolutely be a contributing factor for higher blood pressure. Here's another statistic. Black women are twice as likely to develop severe maternal sepsis as compared to their white counterparts. Twice as likely, that's extremely high. For example, Angelica Lyons in Birmingham, Alabama in 2019 had debilitating stomach pains and went to the hospital for help, and they sent her home multiple times, saying like, oh, these are just normal contractions, you're fine. Sent her home even when she started vomiting bile, and it was only when her baby's heart rate dropped, they did an emergency C-section, and she almost died of sepsis. And sepsis, it's a widespread bacterial infection, usually starts in the uterus. A few years ago, Kira Johnson, a black woman, died at Cedars-Sinai in LA. Her husband saw blood in her catheter bag after a C-section. They told the nurses and the doctors this. A surgical emergency CAT scan was ordered, and it never happened. Hours later, after midnight, she was finally taken back to the OR, but she died of a postpartum hemorrhage. And her husband is advocating for, or trying to bring awareness to racism in healthcare. And he says he firmly believes that if his wife was a white woman, she would not have died, that she would have been listened to. Dr. Shalon Irving, a black epidemiologist in Atlanta, a few years ago, she died several weeks after giving birth of high blood pressure. So this just goes to show, as we said earlier, this is not an issue about lack of health care or lack of education or lack of wealth. This is racism that she was not paid close attention to, she was not listened to. Yes, there are social inequalities that affect these rates, lack of access to health care or lack of access to safe drinking water, food insecurity. Many women have health care coverage for the first time when they're pregnant and then lose it after they give birth. But for all the statistics that we've shown, these studies controlled for wealth and education. They took that completely off the table, and the rates are the same. So this is racism and discrimination, for sure.
I think another one to add to the list is Serena Williams. Like, everyone knows Serena Williams, one of the greatest athletes in the world. When she gave birth, she has some sort of pre-existing medical condition, and she was saying, like, I'm in pain, it's not just the labor, this is a different kind of pain, like, I need this medication. And she knew what to say, what to advocate for, but they were still refusing to listen. And I'm pretty sure she eventually switched hospitals, and they listened to her. And they told her if she had not pushed so hard to advocate for herself, she probably would have died during the labor. And like, she's one of the wealthiest black women out there, most successful. So it's clear that it's like, if she didn't know to advocate for herself that way, she, probably would not be with us today. So some more things to talk about. So it may seem like an exaggeration to say that if a black woman and a white woman go to the same doctor, the same hospital, have the same exact kind of like low-risk pregnancy, that their results can be so farly different. But it's not an exaggeration. It really is the case in this country. So as I wrote here, they may go to the same hospital, see the same doctor, be cared for by the same nurses, and yet receive completely different maternal care as their experience there. And a lot of articles actually were saying, like, the care black women receive is often percentage-wise, like, with their outcomes, comparable to that in developing countries. And white women die from pregnancy-related causes at a rate of 13.4%. African American women die at a rate of 41.7%. So those numbers are so staggeringly different. pregnancy-related causes or, from the birth-related causes. And then Black mothers are twice as likely to receive late or no prenatal care as compared to white mothers. And prenatal care often addresses issues that can cause low birth weight in the infants. And so when you receive prenatal care, not consistently like throughout most of the pregnancy, but only in the later stages of pregnancy or right before labor, that can increase your chances of having poor outcomes. And then, as Sarah was saying earlier, like it's important that we don't equate Blackness with disease. Like the racism is equated with disease and these statistics, but not their Blackness. And then this is just a quotation that is saying basically the same thing. There is, good statistics out there too, though, and hope out there, especially when it comes to midwifery care and doula care. And there's a lot of evidence that says that having a doula present at your birth or being cared for by midwives can greatly, change your outcomes in a positive way. So continuous doula support, in this case that's meaning like continuous throughout the whole labor and birth process, has been linked to the following. So like lower rates of the use of pain meds or epidurals, higher rates of vaginal deliveries, lower rates of C-sections, shorter labors time-wise, higher rates of the parent having positive feelings about their birth experience, higher APGAR scores at birth for the infant, and lower rates of postpartum depression. So those by themselves, you can see how that can, affect your lives greatly and even save lives. And then doulas specifically have also been associated with these emotional outcomes, especially for women of color. This was from a study done, I think, in 2017, where they surveyed women of color who had doulas and women of color who didn't, and then asked them about their emotional experiences after their births. And they reported more feelings of personal security, feeling like they had more agency and autonomy over their bodies. Doulas often help people understand their options, and they act as facilitators, and they stand up for women when they might be in a space where they can't really advocate for themselves. Respect and autonomy granted by doctors. They reported feeling like they had that more by their doctors when their doula was present, and having more access to knowledge and feeling a higher sense of being socially connected. And that kind of comes from doulas. Even if they're just your birth doula and not your postpartum doula, they will often, give you the resources you need for after birth to feel connected, because being isolated in that time is not a good thing. And then just quickly touching on different birthing locations, because of our event on Wednesday that is sponsored, or not sponsored by, but that we will have the speaker from the neighborhood birth center, so I figured it was important to talk about where people may choose to give birth. So I think the one place people often probably think of is in a hospital that's typically attended by an OB or a midwife, labor and delivery nurses, a doula if they're allowed. Some hospitals have rules where a doula isn't allowed, but most don't, especially in our area, doulas are allowed. But during peak COVID times, a lot of hospitals were trying to push doulas out and not allow them in. And we saw the effect of that. Birth center births, so there are freestanding birth centers, which are not licensed and owned by a hospital. They still have hospital affiliation, so working relationships with the hospital, where if someone needs to be transferred there, of course they can be. And those births, midwives work at birth centers pretty much exclusively, and their midwife assistants, maybe a doula. And then hospital-owned birth centers, which sometimes are physically attached to the hospital building. Sometimes they're not, but they're licensed and owned by the hospital. Then home births, which is at a person's home, usually attended by a midwife. Free births is kind of this newer thing people are talking about, which is people who are choosing to give birth completely unassisted, not with a medical provider at all. Oh yeah, and this is just the definition of a freestanding birth center according to Mass Health for this state. It's pretty much the same in other states. So a health facility not operated under a hospital license that is licensed by the Department of Public Health as a birth center. So it's its own license. Yeah, and then looking towards the future, there is a lot of hope among all this disparity and among the growing crisis. There is still hope, and there are a lot of people out there working to change this. So as we've talked about, organizations like the Neighborhood Birth Center, there are lots of other organizations in Boston and in the rest of the country. But the Neighborhood Birth Center is building the first freestanding birth center in Roxbury. They've bought the land, they've raised millions of dollars, and they're working towards actually building it. It's important to center Black leadership, Black midwives and doulas who are trying to bring back those practices that were lost. And midwives and doulas are pretty much usually inherently also activists and fighting for, the rights of the people that they care for. And the more people we can get to care about this issue and know about it, the better, especially men. There's mostly women here today, but it's also important that men know about this and talk about it and, can talk about it in different settings. And yeah, we have sources, but now we're on to the Q&A portion, and I just put a picture of FPL.
Yes, I don't know if anyone has any questions. I want to go. Who asked the statistic? Did you ask about the statistic too? Yeah, I'm not sure. That could be wrong. The percentage that we put up, but the percentage is 3 to 4% higher. So, yeah. I'm not sure about. We could be wrong about that. Right. You wouldn't say 4 to. Exactly. Yeah. Yeah. No, we could have written that wrong. But 3 to 4% Black women are more likely to die of pregnancy-related issues than white and non-Hispanic women. So, yeah. Well, there's an exciting answer to that. There's a movement right now as of this year for Mass Health to cover doulas. I'm not sure what it's been progressing the last year to pass that bill. Do you know anything of the update about? Yeah, it hasn't passed yet. We're close, because that would really help for, people who can't afford, because doulas cost, what would you say, like about $3,000 maybe per birth, or?
It depends where you are, how much a doula charges, because most doulas, have their own personal businesses, so they choose their rate. But often it is out of pocket for the person who's giving birth. So unfortunately, it can be inaccessible for people who can't afford it. But there are a lot of programs that will sponsor completely free doula care. Yeah, the Boston Medical Center has a program. A lot of hospitals have programs, and then there are nonprofits who try to do that too. Yeah, hopefully it passes this year. Yes. Mm-hmm. Yeah.
There's 11 states that it's still legal, and Massachusetts banned it only in 2014. I mean, it definitely should be at a national level, I believe, banned, but it's at state level right now. Yeah. So and that statistic has rapidly changed. When I looked at stats back in, I think it was just 10 years ago. It was something like most states permitted it. So it's rapidly changing, and fingers crossed that it continues to be banned across the country. Yeah.
Is there other legislation around other kinds of issues?
Oh, as a
To childbirth that you think would be
Yeah, I mean, doulas being I would love it if doulas were just a given, that you had a support, because I worked as a labor and delivery nurse, and I know that the labor and delivery nurse, you kind of have this image of like, oh, she'll be sitting by your bedside and holding your hand, and she's not. She can't. She's in and out, going to other patients. She's documenting constantly. And it's really, really important for women to have that emotional support, that hand holding them, that person right there. And a lot, if some women don't have partners to play that role. So I wish that was just offered in hospitals. Not shackling women should be totally outlawed. Healthcare for everyone. Yeah, I wish, yes, absolutely.
Question, do they help with breastfeeding?
Oh yes,
Doulas.
Postpartum doulas absolutely do. Yes, yep, yep,
You
yeah,
mean doulas, right?
yeah.
Is the birthing center going to be doing any training or outreach to people who'd be interested in becoming doulas or midwives?
I don't know specifically. I imagine in the future they will, once it's built and really functioning. I don't think they've specifically outlined that yet. I just don't think they've gotten to that point. But I imagine they will, because it's that kind of organization.
So how does a doula get their training? And a midwife, if you
Yeah.
could just give us a...
That's a good question. There's lots of different doula trainings. So, Sarah did DONA, which is probably the most well-known organization because it's international. And then I did a place called Birthing Advocacy Doula Trainings. And the other thing is there's all sorts of different trainings. You can be trained to be a full spectrum doula, which is birth, postpartum, and anything reproductive that someone might need help with. So a doula can help you through an abortion, through loss of some kind too. And then for a midwife, you can probably talk about that more.
So a midwife, so there are several different types of midwives. There's a lay professional midwife who's not a nurse, and there's a certified nurse midwife, which is what I'm going to become. And those people have a nursing degree, like a bachelorette in nursing, and they go on and get their master's in midwifery, or perhaps their doctorate in midwifery. So I'm going to a school in Kentucky, which I'm excited about. I start in January. It's virtual, and I get to do my residency in local hospitals. Frontier, where I'm going, trains 40% of the midwives in America, actually, yeah. And they've been long distance even before COVID, because they want to train midwives in their own communities across the nation.
I'm wondering, I believe there are some male midwives. I believe I've met one. What about doulas?
Yeah, it's funny because I've been asked before, what do you call a male midwife? Is it a mid-husband? But the word midwife actually it's from the Old English, means with woman. So it's the person who's with the woman. And I haven't met any male doulas, but they're definitely out there. They've got to be out there.
Yeah, I haven't met any male doulas, but I've met a lot of non-binary and trans doulas. Yeah.
I guess this is more of a comment, an appreciative comment. I think it's so important that you stress the history of the double peril that women and other who give birth are in, on the one hand because of racism, and on the other hand because of sexism, misogyny. I have had a personal experience of nearly dying 50 years ago of an ectopic pregnancy because 5 male doctors in a practice would not listen to me and sent me home knowing that I had an ectopic pregnancy but not telling me because they thought I might freak out or something. I mean, they had no experience of that, but as I listened these days to the debates around abortion, I'm just acutely conscious that it's not just abortion, it's other things. I would have died if I had lived in a place, where attention to ectopic pregnancy was legislated, and it's just really kind of shocking. I'm so glad you're doing the work you're doing. Thank you.
Well, thank you, and your experience is, well, I'm sorry you went through that, and it's unfortunately not uncommon. Yeah, we hear those stories. Yeah. Yeah, I'm so sorry. Yeah, yeah. Yeah, yeah.
Hi, thank you. This is so amazing. I have a question. When you, do both of you assist births in hospitals? Like, and how are you received? Like, do you feel like hospitals are open to doulas and midwives? And also for Sarah, when you get your degree, like, what will that look like? Like, where will you be employed? Like, how will that change what you're doing now?
Well, I live a half mile from Emerson, so I'm hoping that I can work. Emerson has a great midwifery program there. But yeah, I worked for a couple of months as a labor and delivery nurse at Winchester Hospital, and there were no midwives there. And unfortunately, I left. I didn't fit into the birth culture there. And one of the problems was occasionally when a doula, there weren't many doulas, but occasionally when a doula came in, my fellow nurses would be like, oh, here comes a doula, or, oh, here comes a birth plan, great. Because they knew that this patient would have a stronger voice and would often push back against, there were very cookie cutter births. It was kind of like someone came in, the birth was slow because women's bodies often, labor slows down when they're in an unfamiliar environment or they're scared, or, and then so the doctor would be like, we gotta pick this up, because we only have 24 hours, and this is, they have hospital policies, birth must occur within 24 hours, so let's put them on Pitocin, which speeds up and it makes the contractions more intense, very unnaturally, and that's super painful for the woman, so all right, let's give her an epidural. The births looked all the same, and 1/3 of the births ended up being C-sections as well. But when a doula was there, frequently it was a woman who had already thought about, like, okay, I want to try unmedicated, or I want less interventions. And nurses and doctors, it's a complicated question because obstetrics is one of the #1 sued specialties in medicine. So there's a lot of fear in doctors and nurses. So when a doula says, hey, this woman doesn't want a C-section, doesn't want pain medication, doesn't want Pitocin, they're like, we don't know how to deal with this. Or they think it increases the risk. So from what I've seen and what I've heard from fellow doulas is they're not super welcomed, and there's often a clashing rather than a collaborative feeling between doulas and nurses. Do you have anything to add to that? No? Yeah. And for myself in the future, I think it'd be lovely to work at a birth center like the one they're opening in Boston, but I also feel like women who give birth in hospitals, I kind of feel like they might need me more, so I think I'd like to work in a hospital, yeah. So, yeah.
Yeah, I mean, actually, the point you just made about the being sued, I think is what's held things back, is when things go wrong, they go wrong very fast, and and having a baby who isn't impaired or dies, it's you need to be able to have a plan to respond to that, because you can't always predict it. I think it's surprising how well the I think that's why the statistics are so high. It's also for the C-sections, it's also because it's more convenient for the doctor, obviously. The prolonged thing, I think there's also some risk for how long you have the membranes ruptured in terms of getting infections too. So it's a they're always walking a tightrope, as you know, in obstetrics, and trying to do the thing that's going to maximize the outcome for all. So I think it's very interesting the way this field is moving. The other thing I was going to say was in the I guess when there first started to be OBGYN doctors going from person to person, they didn't know anything about bacteria causing infections, or the fact that you needed to wash your hands or not wear the same suit And so they literally, carried the bacteria from one person to the next and increased, there's an enormous death rate from that.
Yeah, that's a good point too.
so-
Yeah, yeah, good point.
I just wanted to thank you for the information. And also, I think it would be amazing if every woman would be offered a doula for their birth, because I had a doula when I gave birth to my daughter, and she was my savior. She was my angel. She spoke to me when I couldn't communicate with the doctors, and when my husband was just at some point, kind of useless because he was terrified. And
Fainting in the corner. Yep.
Yes,
Saw that
you
all
know.
the time. Yeah.
And she was just amazing, and it made my experience totally incredible. She came to my home. I walked up and down my street in labor for as long as I could, and we drove to the hospital and to the city, and she just was amazing. And I just wish every woman could have that experience. Other people I've talked to are like, wow, what was that? What did you have? But it was just made the whole thing just wonderful. And then the great part too is that after the birth, we sat down and talked, because there were some things I didn't remember, having no medication and giving birth to a 10-pound beautiful girl. I was working pretty hard. So we went over it together, and she's like, well, and I said, oh, I remember this, and we wrote it down together, and it was like, I have that, because some of it I didn't remember, and it's the most incredible experience. So that is wonderful. I'm going to look at that, and when I go home to California too, to see if they do that in California. Everybody gets a doula. Two would be
Love
good.
that too would be good. Oh,
Yeah.
thank you for sharing that. That sounds like a beautiful experience, and even just a process too.
Just to
you know?
continue with that, my daughter-in-law had a doula, and it made her, it was so beautiful. It was a beautiful experience. But my sister in England had one of her 4 children with a midwife at home. So that's a contrast for you.
Yeah, wow.
All right.
How was that experience for her?
Well, she was fine.
Okay.
She was fine. It was years ago, needless to say. Not just the other day.
Yeah, thank you guys so much for listening to us and coming. We appreciate it.
Thank you very much. Thanks, everybody, for staying, and hope to see you Wednesday night.